Okay, so we have Lucy, 23-year-old graduate student, came into the office complaining of sharp left upper quadrant pain. What in the world is in the upper quadrant, left upper quadrant? Liver's on your right. Possibly kidney, possibly pancreas, possibly spleen. Okay. Acid reflux. Okay. Nausea that gets better after she eats fatty food. Oh, maybe we're talking about the stomach? She runs track at her school and takes ibuprofen 3 times a day for sore knees. Well, that's unfortunate. She also smokes and drinks every weekend and sometimes during the week with her friends from school. Wow. Reminds me of a guy in high school that had that kind of lifestyle, and he was actually still a pretty good track runner. I don't know. She says she has not traveled in the past 6 months. CBC shows a high C-reactive protein, which means inflammation, and a pH of 7.33, which means acidotic. Okay, so maybe she's got some kind of acidosis going on here. Endoscopy of esophagus and stomach show inflammation and a 2.5 centimeter perforation in the stomach lining. Okay, that is a definition of what? An ulcer, right? Peptic ulcer, gastric ulcer, some kind of ulcer. Other than the NSAID use, what are other possible causes of this condition? Okay, now, having said that, NSAIDs are known, as in chronic NSAID use, are known to actually decrease that protective stomach lining and cause ulcers. Okay, so other than that, what are some other things that might cause an ulcer is really the question. Anybody happen to know? What? Smoking, you said? Yeah, smoking causes everything. Seriously. Just put it on the list. Any pathology, odds are pretty darn good smoking is involved in it. There's very few exceptions, really. Okay? So, we're talking obviously about ulcers, depending on where they are, whether it's in the stomach, the duodenum, or esophagus. Okay, they are still considered peptic ulcers. When you have an ulcer like in the esophagus, obviously that's not a place where you tend to get ulcers as a first place or origin. Okay, you tend to get them in the stomach, and then acid reflux keeps coming back up in your esophagus until it ulcers. Okay, so usually we're talking gastroesophageal reflux disease, or GERD, because that acid is coming back up from the stomach into the esophagus. Okay, causes. Anybody know what H. pylori is? Helicobacter pylori. Okay. That specific bacterium, I guess, we have thought many years that is causing ulcers, okay? Because when people have ulcers, they find H. pylori a lot, okay? There is some recent evidence and research that says that may not be true. It may just be a correlational statistical thing. Jury apparently is still out on that, because they still, and you still, will ask for H. pylori breath tests for people to test H. pylori for somebody who keeps getting ulcers. Okay, so that it's still out there. Whether or not it's really true or not, at this point, I absolutely have no idea, because the research does seem to argue with itself. NSAIDs, like I said, more than 50% is from people chronically using ibuprofen, Motrin, Advil, there's a bunch of them out there, right? They decrease the stomach lining protection, and then the acid can just eat right into the stomach. Okay. Stress, ETOH is, my phone just fell over. ETOH is, you guys know what ETOH is? Ethanol, as in alcohol. You'll get used to it. That's how everybody, once you get out there, is writing ETOH in the charts and stuff. It's just faster to write it. Okay, ethyl alcohol. Okay. As far as the signs and symptoms go, again, they should relate to the pathology, right? We have a hole in your stomach, so it's going to hurt. That whole pain with the arrow, typically decreased pain, what that means is kind of like in the case study. Temporarily, if you eat fatty foods, it'll kind of coat that hole for a minute and decrease the pain there for temporary. On the other hand, eating fatty foods can actually cause the lower esophageal sphincter to become loose or saponified, and that can actually cause you to have more acid reflux. So it's a temporary fix, not permanent. In fact, it causes more damage in the long run. Okay, so NV always means nausea and vomiting, weight loss because you don't want to eat, hemoptysis, which is, does that word mean? Hemoptysis, anybody know? Hemoptysis, that's coughing up blood. Okay, melena or melena, I've heard it both ways. That is your black tarry stool. Okay, why is it black and tarry? Because there's blood passing through that system. That's what blood looks like by the time it comes out the other end. It's just black and tarry. Okay? Questions on peptic ulcer? Okay, we'll move on then. Another case study. Ellie, 55-year-old female, presents with a need to urinate frequently and has pain while she does. What's that say right offhand?
UTI.
Probably screaming UTI, right? Okay. She also complains of lower back pain and persistent abdominal discomfort. Okay. Ellie has come to find herself easily confused lately and has a known history of diabetes mellitus, which is controlled through medication. After examination, all vitals came back within normal ranges. However, a urine sample comes back positive for nitrates, hematuria, and bacteria. So again, likely cause, UTI. She also has some issues because it sounds like her kidneys are actually hurting. Okay, so that lower back pain, sounds like that UTI may have gone all the way backwards. When it goes all the way up and hits the kidneys and causes problems, we call that pyelonephritis. Okay, that can be a problem. Okay, so a lot of reasons, as you see from this slide, to have bleeding in the urine or hematuria. Okay, UTI probably the most common by far. Okay, it could turn into pyelonephritis. You could just have kidney issues, nephrolithiasis. For men, obviously, benign prostate hyperplasia could cause bleeding in the urine, just because the damage. Okay, you could obviously have trauma. Somebody gives you a good kidney punch in the back there, it could cause bleeding in the urine. Any kind of thing that thins the blood will do it. Some medicines, just like penicillin, just cause occasional bleeding in the urine, which is a weird side effect. Okay. Strenuous exercise. I don't know who you are, but if you are exercising so hard you are bleeding into the urine, you probably need to calm down a bit. Okay. Okay. Post-streptococcal glomerular nephritis. Call it PSGN for short. Post-streptococcal glomerular nephritis. It's just like what it says. It's after you have a strep infection like strep throat, and that strep throat was not treated, it went, the strep bacterium itself went systemic into the blood, down to the kidneys. Sometimes strep will be attacked by the immune system at that location, and it'll cause havoc, basically. You clog up the glomerulus, you clog up the filter of the kidney by having these deposits of, I don't know, shrapnel between the fight between the antibodies and the bacteria. Okay, they leave behind wreckage. They leave behind what we call vegetations, and that's kind of like a scar tissue, cheesy looking mass that, again, it can clog up the glomerulus and therefore punch some holes in those filters and cause bleeding in the urine. Okay, the same thing can happen, by the way, with the same strep infection. It can also have its little fight in heart valves, and that does happen sometimes. Okay. Also, we're coming up another month or so on Thanksgiving. Be careful. People have false positives. They think they're bleeding in the urine because they had too much cranberry sauce and rhubarb pie and beets and what?
Isn't that the time of the year when it's the highest death rate is Thanksgiving?
The highest death rate?
Yeah, it's just randomly a ton of people. Or is that Christmas?
I know there's a lot of suicide around Thanksgiving to Christmas, because people are feeling very lonely and sad, and I don't know what that is. We don't even have a speaker up here, and it just makes that noise, all the speakers, every once in a while. Don't have a microphone, I guess, is what I should say. I don't know why it's doing that. Anyway, are we out of time or something? We have 2 minutes? All right, so we'll catch this next thing later. So we'll move on next class and talk about this small boy, 4 years old.